This video is an instructional on blood pressure by Jonathan Martinez. Blood pressure is an important measurement which can assess the level of risk for cardiovascular events, and that should be taken prior to starting an exercise program. An individual's blood pressure should be determined from more than one measurement during 2 or more different occasions. To assess blood pressure, follow these procedures. Make sure the subject or patient has been seated for at least 5 minutes in a chair with back support. Feet should be flat on the floor and arms supported at heart level. It is important that the patient has not had any caffeine or smoked 30 minutes prior to the examination. Now, choose an appropriately sized cuff for the individual. Wrap the cuff around the arm at heart level and align with the brachial artery. There should be a marking on the cuff to indicate what part of the cuff goes with the brachial artery. The cuff should fit snug, not too tight, but not loose enough for it to be moving around. Using either the bell or diaphragm side of the stethoscope's chest piece, place the chest piece below the antecubital space over the brachial artery. Make sure that when you are using the stethoscope to hear, the prongs are facing forward when wearing it. Pump to inflate the cup to approximately 160 through 180 millimeters of mercury. After reaching this value, slowly release the air. Here for the first Korotkov or thumb sound. This is the systolic blood pressure. Here for the last Korotkov sound. This is the diastolic blood pressure. Depending on the measured blood pressure, the individual will be categorized into one of 4 categories, namely normal, prehypertension, stage 1 hypertension, and stage 2 hypertension. Normal blood pressure is defined by ACSM guidelines as systolic and diastolic blood pressures of less than 120 millimeters of mercury and less than 80 millimeters of mercury, respectively. Prehypertension is defined as a systolic blood pressure of 120 through 139 millimeters of mercury, with a diastolic blood pressure of 80 through 89 millimeters of mercury. At this point, healthy lifestyle modifications are recommended, such as physical activity, weight reduction, a healthy eating plan, dietary sodium reduction, and moderation of alcohol consumption. Stage 1 hypertension is when an individual has a systolic blood pressure of 140 through 159 millimeters of mercury and a diastolic blood pressure of 90 through 99 millimeters of mercury. Once an individual has a systolic blood pressure of 160 millimeters of mercury and above, and a diastolic blood pressure of 100 millimeters of mercury and above, he or she has stage 2 hypertension. I hope this information was useful. Thank you very much for your time. All the information was gathered from ACSM Guidelines for Exercise Testing and Prescription, 10th edition.